Hello and welcome to the Dr. Rita's Women Matter Masterclass. My name is Dr. Rita and I thank you for being in this masterclass today. And today we have quite a number of slides to run through, so I'm just going to go straight into it. This is the first edition of this Women Matter Masterclass. The next edition is going to be next year because we are doing it yearly. And please, you can drop your comments on the group. I will respond to you from there. I hope you can hear me well. I hope your sound is clear. You are able to access it. So please. So this is the first edition. The next edition is going to be next year. And next year, we're going to be dealing with cancer. By God's grace, we're going to be dealing with cancers. But this year, we're just looking at some general topics. And next month, we're going to go into another masterclass. Now, this masterclass is strictly for educational purpose, please. And should not replace professional advice from your doctor. And this training does not in any way certify you to be a doctor, nor does it give you permission to diagnose or treat anyone. This is information for you, for your family, particularly for you as a person to know how to help your daughters, help yourself, and even your parents. Now, this training can only be used within the context of this lecture. Do not extract any part of this training and use it for something other than the purpose for which it has been designed. And I can assure you at the end of this training, as with all my trainings that you have been, if you have been privileged to attend any of my trainings, you find that they are very beneficial. How much more do you want that you have paid? One of the reasons for which we ask people to pay is so that they can be committed to it, and then also to be sure that people that really want to learn will be in the place, and that's why we're here. I'm going to run through the course content in this program. We're going to be running through a 2-hour program, and then I'll take some questions at the end of it. So if you have any question, you can drop it on the group. I would attend to the questions. Now, this course content is going to talk to you about different conditions that affect women. I'm going to list out the causes of this, and then I'm going to list out for you home remedies. Now, the home remedies part are the things that you can do. As much as possible, the pictures for some of these things that I think may be a challenge or for you to identify is going to show on the screen, and then we will also drop it in the group also, but it will show on the screen. Please follow through this training. Listen, you have access to this training for the next 1 month. By the next month, when we are moving to the next masterclass, we're going to take down this video and repackage it together, and it's now not going to be 5,000 at that point. At that point, it's going to go for 50,000 because of the value of the content that is inside. So it's been discounted for you for a reason, so take advantage of it. Now, the course content, we're going to be talking about fibroids, types of fibroid, what causes fibroids, and home remedies and the things you can do about fibroid. We're going to talk about hormonal imbalances. We're going to talk about menstrual irregularities. We're going to talk about menopausal syndrome. We're going to talk about breast abnormalities. We're going to be talking about PCOS. We're going to be talking about PID and other vaginal infections. Now, all these things I've listed are things that affect women. And very many of these things are reasons why women are not having a complete, or I don't want to say they're not, some women are not having the best of themselves, some of these symptoms. And I'm going to give you several other things that you need to know as a person that you need in your decision, in your choice of makeup, in your choice of nail polish and all that. I deliberately did not wear makeup today. That's because when in the course of this training, when we get to the xenoestrogens, you will understand what I mean by that. And this means that unless you really have to, as much as possible, be natural, you are safer when you are natural. And as a woman, your hormones play a lot in your health. And so please take everything that you are learning today, take it very seriously, because This is information that you will not find just lying around. And a lot was put in place to put together these things for you. And I welcome you once again from wherever you are watching me from. Thank you for logging in. Thank you for paying attention. Pay attention to the end of the video, and then you can ask your questions. Thank you. So I'm going to go right into the class. The first topic, like I said, is fibroids. Now, what are fibroids? Fibroid is a disease of the uterus. It is a tumorous, but is a non-cancerous growth. And this growth occurs on the walls of the uterus, known as, they are called uterine fibroid. Now, we have different types of tumor around different parts of the body. The same thing that causes tumor in the fibroid will cause tumor in the lungs, will cause tumor in the liver, will cause tumor in the brain, there are different types of tumor. Some of them are local, meaning that they will not spread, and some of them will spread. So when we say a tumor is non-cancerous, we mean that it will just be localized. It will grow in that place, but it will not spread from there to another place. We have these same tumors that happen in the uterus. We find them in the lungs also. So don't think that they are only found in the uterus. No. However, the cause and the pattern are different. Now, it is not dangerous. Fibroids are not dangerous diseases, but they may lead to anemia due to heavy menstrual flow. Now, it is said that fibroids are more common in African women. As we go on, you will find out why blacks are more prone to it. Now, there are different types of fibroids. Now, the image of the fibroid is going to just show on the screen. Please look at it, so that as I talk about the different types of fibroid, you will see it. So on that one image, you will see the different types of fibroid because of their location. It will be just showing on one side of it or just a part of it. Now, we have the submucosal fibroid. Now, this is a fibroid that grows in the innermost cavity of the uterus called the myometrium. If you look at the image, you will see it right on top there, which is the submucosal fibroid. Now, this particular fibroid, it leads to heavy blood loss. It will cause prolonged menses. It will cause difficulty in a woman being pregnant. If the woman is even able to get pregnant, it will cause the woman to have frequent miscarriages. So different fibroids causes different symptom approaches and causes different problems in the body. A submucosal fibroid is the type of fibroid that will cause a woman to have heavy blood loss. Will have the woman to bleed for 15 days, 20 days non-stop. Will make the woman have problem conceiving, and even when she conceives, it will make her to have frequent miscarriages. The second type of fibroid, which is the intramural fibroid. Now, this intramural fibroid, it grows in the middle layer of the uterus called the endometrium. If you look at it, you will see it there. You see it there. Now, this type of fibroid would also lead to heavy menses, will cause prolonged period, will cause pressure or pain in the pelvic region. This type of fibroid will grow so large that it will change the shape of the female's uterus. The third type of fibroid is the subserous fibroid. This subserous fibroid grows in the outer layer of the uterus called the serosa. This fibroid grows to such an extent that they put pressure on the uterus and lead to urinary problems. If these fibroids begin to grow in the back side of the uterus, it may damage the rectum. The woman has a problem going to toilet. This particular type of uterus fibroid may not cause the woman to have excess bleeding, but will cause a lot of pain. Will cause the woman to have problem with urination. You see, now this type of fibroid would also cause the woman to have constipation. If this is the type of fibroid that will make it look as if the woman is pregnant, you see. Now, this fibroid in question will not cause excessive bleeding, may not affect pregnancy, but will cause a lot of discomfort. We have the fourth type of fibroid, which is the pedunculated fibroid. You can look at the image that is coming up on the screen. Now, this type of fibroid attaches itself to the stem. You can see it to the stem. You can look at, you see something like a branch that comes off. You see it attaches itself to the stem of the uterus. And this can be either internally or externally. Then we have the cervical fibroid, like shown on the image right there. You see the fibroid. The fibroid will grow in the cervical tissue. It would even close the mouth of, it could grow so well that it will close the mouth of the cervix, that sperm will not be able to pass. Menses would be trapped inside. So the woman will be menstruating, but the menses may not be flowing outward. Then the last type is the interligamentous fibroid. This is a very rare type of fibroid. It forms on the fibroid is held up by ligaments attached in the pelvic wall. So the ligaments, when these tumors grow on that ligament, that is what this is. Now, the image, I'm sure you have looked at the image now, so the image will be taken off. So what are the things that causes fibroid? What are the triggers for fibroid? There are several things that you know. I'm not going to tell you what you know. I'm going to tell you what you do not know, because that's what this training is for. Yes, you hear that diet, obesity, yes. But the number one leading cause for fibroid in a woman is estrogen dominance. When the estrogen levels are much more than normal, this is the leading cause. Number two is improper clearance from the liver. One of the key responsibilities of the liver is to remove waste. Now, one of the waste that the body must remove is excess from hormonal activity. When there is any disruption, and we'll go into these disruptions as we go on, when there's any disruptions, you find out that the woman herself, her liver is not clearing properly. These reserves that are not cleared up, that are supposed to be cleared up as waste, they will send a feedback back to the uterus and stimulate unnecessary growth. So you hear that, oh, when a woman did not give birth on time, not giving birth on time does not cause fibroid. Having sex early or late does not cause fibroid. Being a virgin does not make you to have fibroid. Particularly these triggers like your hormonal, your hormone, your estrogen dominance. Then another key causative factor is what you know as xenoestrogens. Please pay key attention. Xenoestrogens. Xenoestrogens are things that mimic. Now, there's no image for xenoestrogens, because that's like your hormones. There's no image to show you hormones. You just see chemical activity. Xenoestrogens are defined as anything that mimics estrogen in the body. Anything that mimics estrogen in the body, that mimics the normal estrogen in the body, that now affects normal regulation, that is xenoestrogen. That's in a general term. But medically, these are defined as chemicals that mimic some structural parts of the physiological estrogen compounds produced in the body. Therefore, they may act as estrogens or could interfere with the actions of the normal estrogen in the body, what we call the endogenous estrogen. So there are things that you will eat, there are things that you will consume, that their chemical structure, their chemical makeup mimic the normal one that the body produces. Now, because they are alike, they are not the same, but they are alike. What happens is that they now interfere with the normal one. Then the body begins to feel that, there's too much. So the body will slow down in normal production, then give way for this chemical one that mimics it. This one that mimics it will now cause things to begin to grow in a way that they are not supposed to grow. Let's go on the xenoestrogen. I'm going to spend some time to talk about it because estrogen is a very important hormone for a female. They help in regulating reproduction, they help for your menses, they help for your bones, they help a lot. So I need to talk about this xenoestrogen because it's a leading cause of a lot of female disorders. As we go on, you will understand what I'm saying. Now, these xenoestrogens are a subcategory of the endocrine. Now, hormones are produced by what we call the endocrine system. So these xenoestrogens, what do? They disrupt they go to the endocrine where the estrogen is supposed to be produced. The gland that is responsible for stimulation of production of estrogen, progesterone, they are the endocrine glands produces this. Now, these xenoestrogens, by the time they are working, they send message to the endocrine gland. The endocrine gland will send message to the ovaries, which is responsible primarily for production of these hormones. Then they begin to disrupt the work. They disrupt the work because they have estrogen-like effect. They will go and stimulate menses. When your normal menses should come out on the 17th. When you have a lot of these xenoestrogens, they will go and stimulate. You have finished your menses on the 17th, but because you have a lot of xenoestrogen, on the 27th, xenoestrogen will send its own signal. You see, you find out that you are menstruating 2 times in a month. Estrogen is a normal hormone in humans and is responsible, like I said, for bone growth, for blood clotting, for reproduction in men and women. Now, the body regulates the amount needed through what they call intricate biochemical pathways. But when this xenoestrogen enters into the body, they increase the total number of estrogen in the body, resulting in a condition known as estrogen dominance. Now, it's not as if your body is producing too much estrogen. It's that the normal estrogen plus the one that is added together, having the same effect, triggering the same responses, have too much. Then you find the person who having estrogen dominance. Now, when they enter into the body and they have called this estrogen dominance, one thing you need to know about normal estrogen, I told you, I said, normal estrogen, when the body is done with hormonal activities, with normal activities, the body will break down. Unnecessary hormone they will deliver. That's one of the functions of the liver, to remove these things, the excess and the product of waste from the body. But xenoestrogens are non-biodegradable. It means, therefore, that your body does not have the ability to discard it. It is like a nylon bag. If you see nylon are non-biodegradable. If you put nylon in the ground, in the next 100 years, that nylon is still the way it is. That's how these xenoestrogens are. They do not get destroyed. They cannot be removed from the body. So what do? They have affinity for fat cells. So they bind to fat cells in the body, and they are stored in the tissues, in the fatty tissues in the body, in the fatty cells in the body. Now, this buildup of xenoestrogens have been indicated in many conditions. Conditions like breast cancer, prostate cancer, testicular cancer, infertility, endometriosis, early onset of menopause, miscarriages, diabetes, like I said, infertility. You find a couple who go to the hospital, she's normal, everything is normal, but she's unable to conceive. The accumulation of xenoestrogen in the body is the cause of that person's inability to conceive. So, my dear ladies and gentlemen logged in today, I want you to know that xenoestrogen is the modern day demon that is tackling both men and women. Because we are focused on women today, this month, that's why I'm not going to be talking about so much about the effect it has on the man. What are the sources of xenoestrogen? Remember that they are synthetic, they are chemical, and they mimic the natural one in the body. So they can be found in your pesticides, your fleet. They can be found in your herbicides. They can be found in your perfumes. They can be found in industrial waste. These pollutants, like I said, are lipophilic. They attach themselves. And so they can pass up from the food chain in animals. So the cow, you know, when people have fibroid and I tell them stay away from cow, anything that comes from cow, then they begin to ask me, why should I stay away? Because cow has what you know as xenoestrogen. The estrogen in cow mimics exactly that which is in humans. So don't say whether you roast it, whether you dry it, that is what forms the flesh. The makeup of the cow. In the milk, that is what makes that cow as it is, as big as it is. That is what makes the cow. You see. So, this is one of the reasons, if you are concerned about your health, you have to stay away from cow meat. So, whether you say, is it shake, is it pomo, stay away from it because of the xenoestrogen. If you have a family history of someone who has had cancer of the whatever it is, as a woman, as a man, you need to pay very keen attention to these things that you are learning today. So, remember that heat does not disturb it and it cannot be destroyed. So, they can be found in meat. They can also be found in some fish, but they are more in meat. They are found in dairy products like your milk, your butter, your cheese. Even though they are in small quantities, the issue is that we are now dealing with the accumulative effect over a period of 10-15 years. These are the things you eat every day. After 10-15 years, their build-up becomes such that they begin to manifest. You see? They live in the body and they tend to store up in the body. And with age, the only times when the circumstances that makes these xenoestrogens to be released in the body are during the period of weight loss. You keto, you people that want to do keto, that say you are eating, using fats, you are cutting away carbohydrates, you are only eating only fatty and protein. You are making it easier, you are adding to your body xenoestrogens. Also, period of long fast, you fast for long, you don't drink water. When you are fasting, you must be drinking plenty of water and you ensure that you are eating plenty of fruit. You know, so these are conditions that can make these xenoestrogens that have been stored in the body to come out and become more manifest, or their effect becomes even much more. And the thing is this, that a baby can suck from the mother and pick up xenoestrogen because it will pass from the breast milk. It does not get destroyed by anything. So once it's stored in the woman, it will go from the mother to the child through breast milk. And so, if the mother has very high level of xenoestrogens, the child is going to be consuming a very high load of it. Are you wondering why we have a lot of ADHD, attention deficit, hypersensitivity disorder? We have autistic syndrome, spectrum syndrome. You see, we have these chromosomal changes. when these things happen, I have some mothers who have children like this, and they begin to look outside. And when I tell them the problem is from you, your child picked up. So this is not to make the mothers to be, to make them to be guilty or anything, but this just shows that you need to be careful. Now, these xenoestrogens may also enter the body through storage procedures. Your plastic containers, your plastic can that you used to cook. You know, those of you that will now put food inside plastic, you now put the plastic on the fire inside hot water. It makes your plastic container, one of the active ingredients or one of the active chemical components has this xenoestrogen in it. It's not a, you can research it. It's not a, you can even go and research xenoestrogen. XXENOESTROGEN. Xenoestrogen. You can do your own study and find out. You see, these plastic containers are used to store food. They can provide exposure to estrogenic compounds. Now, one of such compounds is called bisphenol and phthalate esters. You see, look at your container that you use to store fatty food, like your oily stew. You will find out when you put container, you pour hot soup, that oil your soup inside a bowl. When you wash the bowl, you notice that it's as if there's a residue of it. There's an interaction between that fatty substance and the container. So I'm going to list out some of these sources of xenoestrogens, but this is not all, because I mean, if I had to do a study of only xenoestrogen, I could do it for the next 3 hours. So they are found in, I remember some days ago or some weeks ago, I did a video about cucumber. And I told you that if you go to the market and your cucumber is very green as that leaf in my back that you are seeing there, so that is pesticide and herbicide and fertilizer you are drinking. This fertilizer, DDT, and some other fertilizers that they use, they have been loaded with so much chemicals. It will look very green and fine. Please don't buy it. Any leaf that you go and buy that you did not see ant has eaten a part of it, don't buy it. That thing is loaded with a lot of xenoestrogen. They can be found in your water bottles. They can be found in your nail polish. They can be found in your makeup kits. Read this thing I'm saying. Just check. You'll find these things I'm saying. It's written on it. Your makeup kit, your birth controls, and so on and so forth. These are some of the sources. So why you are wondering why I did not make up? Personally, I don't like makeup. And so I used to calculate how much of makeup I use in a month. So once I've made up more than the number of time, I think I should. It doesn't matter what is happening next. I'm not good. That's why you're not seeing me on makeup today. So how do you minimize your exposure to xenoestrogens? Number one, your food that you eat. You need to ensure that as much as possible, your chicken that you are buying, you know that they use a lot of hormones to do chicken now, so that chicken will quickly grow. Please go and look for someone that you know has the fear of God in them, that does organic farming, or at least safe farming, in the sense that they allow the chicken to follow normal process, not a chicken of 2 weeks. And that means that your chicken and chips you are buying, all those chicken that you are buying that you see very soft and tender chicken. Normal mature chicken, the flesh is not very soft and tender. These things have hormones in them. The hormones, and whether you are putting it in air fryer, I just told you that non-biodegradable, they will store in your body from the day you are exposed to it till the day you leave this earth. It will not go. It will remain there. You cannot excrete it. Your body is not designed to be able to excrete it because it is not a normal part of the body. The one that your body produces, your body will excrete it. But shall you see this one? It will store in the fatty tissue. That's where the problem is. The problem is that if it's just one-time exposure, The problem is that because the one you ate when you were 15 years old is still there, you see it when you are 17, 18, 19. By the time you are 55, you are wondering why you are having non-stop palpitation. You are wondering why the menopause is not giving you breathing space. Your xenoestrogen. So you need to eat organic things. Organic. You see catfish. Catfish is one fish that is so grown, and the way it is grown has made it not safe for humans. I'm telling you the truth. You paid for this class. You can hear this. Go and find out about studies on it. So you need to avoid all things that have pesticides, herbicides, fungicides. You see? Then you need to choose locally grown and in-season fruit. Then your fruits, some of your fruits, you need to peel them. Ensure that you peel your mango. I advise you, don't eat mango with the skin. Peel it off. I advise you, don't eat apple with the skin. Peel it off. When you put your vegetable inside water, the color of the water should not be green. It should be ordinary. If your vegetable is turning green, please throw that vegetable across the water away. Any vegetable you buy whatsoever, lettuce, whatever it is, cucumber, you are rinsing it, is turning green. If it is too green, don't buy it. It should not be very green. No. You are just drinking, you are eating the hormones. So your frozen turkey, frozen chicken, you know where already. You already have idea of that. Your plastics. Reduce the use of plastic wherever possible. Do not microwave food in plastic containers. When you go to fast food and you buy your meat pie, you now put inside nylon, you now put the nylon inside the microwave. Please avoid doing that. Use glass or ceramic as much as possible. Do not leave plastic containers under the sun. This is one of the reasons they say don't. Then also, if your water in your plastic container has heated up significantly, throw it away. Then you know this one that they will now go and you will be buying Zobo that they have used the cup. They have used the Zobo or the drink that the person used another product. You know, they will empty it. They will now put it. Please desist from all that. You are exposing yourself to more xenoestrogen. Avoid freezing water in plastic bottles to drink. You see that one that will put it inside freezer. These are things that are not beneficial to our health. Go and get glass jars. You heard me right. Glass jars. Now, let's move along. Your creams. Health and beauty products. Avoid creams and cosmetics that have these chemicals. I'm going to call it to you. That's why it is a video, so you can slow down, listen to the pronunciation. They are called parabens. P-A-R-A-B-E-N. If your cream has parabens, that means that it has estrogenic ingredients. Parabens are estrogenic. They are xenoestrogens. If you can imagine when you give birth to your daughter or your son, you start rubbing in parabens. By the time he's 15, he's beginning to manifest some symptoms of a disease that a 57-year-old person should be having. Exposure. Just check the label. You see, these paraben and stearal colonium. That means S-T-E-A-R-A-L. If this can be typed on the screen, I will appreciate it. S-T-E-A-R-A-L-K-O-N-I-M. I'm going to take it again. S-T-E-A-R-A-L-K-O-N-I-U-M chloride. Sterconium chloride. And parabens. P-A-R-A-B-E-N-S. These two, they should not be in anything you are using. Check. I don't have any brand for you because I've not done study on all that. Check to be sure that what you are rubbing doesn't have these 2 chemicals. If it has it, please stop. Someone came to me with biting sensation in her breast, and I asked her, have you just changed your cream? Because she did tests, and there was mammogram showed that there was no growth, but she was having a lot of pain, biting sensation, serious pain. So I asked her, I said, have you just changed? She said, yes, she just got one cream that you used to rub her body, blah, blah, blah. It turns out that that cream had an ingredient that was seriously carcinogenic. I just gave you 2 of them now. Yes, it's on the screen. Anything you are taking that has these 2 chemicals, throw it away. So you can take it off now. Number 2 thing that you need to minimize is your exposure to nail polish and nail polish removers. The reason for this is that plus your nail polish plus the fact that you will use it to touch food and put in your mouth. That is one of the reasons. Then you now add your chemical content into it. Also, use naturally based fragrances such as essential oils. Try as much as possible to use chemical-free soaps and toothpastes. In your household, in your toiletries, your sanitary towel, your pad, your tampons, your paper, as much as possible, use chlorine-free products. You see, use chlorine-free products. And the things that you are using, check to be sure that they are biodegradable. Look at the thing, look at it very well. Look at it. It will be written. If it is non-biodegradable, run away from it. Anything that will not decay, don't put in your body. Now, what are the home remedies for fibroid? Remember, there are different types of fibroid, so I'm giving you the home remedy that cuts across all the types. Now, depending on what is the cause of your fibroid, depending on the type of fibroid that you have, you see, remember that this is an educative information for you. This does not by any means mean that you will now negate yourself. If you are bleeding too much, if the bleeding is too much, then you may need to seek a professional. You can seek for consultation, for guidance. You know, sometimes also we ensure that we tell the person to stay off food, like do a 3 weeks only fruit for 3 weeks. Just get different fruits and eat. Why? You want to reduce the load of xenoestrogens that is working. You want to slow their work down. So you're eating fruits. So some of these home remedies are things that you can try. The first remedy is your carrot, beetroot, and wheatgrass. Combination of these 3 helps to build blood, helps for your estrogen levels, you see. So you get 1 carrot, you get 1 small beetroot, your wheatgrass, you get a tablespoon or a teaspoon of it, mix them together, blend them. I didn't say juice, blend them till they are smooth. Add a glass of water, blend till it's very smooth, and drink. Drink this once a day for like a month. Remember, when you are doing natural remedy, don't as if you do 2 days and say it's not working. You have to do it consistently and watch yourself. Or you can do turmeric and black pepper. You just take a pinch of black pepper, you grind a small piece of turmeric, grind it, add a pinch of black pepper to it, add it inside your hot water. You drink daily for 3 weeks. Now, irrespective of what you are doing in the course of this therapy, in the course of these slides, this class, I want you to note that do not do any therapy during your menses. That's also where people put themselves into trouble. When you want to go and start drinking therapy, and that's why when I tell people, when people go online and they are beginning to drink things, and I ask them, do you know the side effects? You do not drink anything during your menses, otherwise it will alter your natural process. Some people were trying to solve a problem and ended up with a bigger problem. You know why? They didn't know that during your menses, you do not take anything. Any remedy that has to do with menstrual cycle, you do not. Because that is the end of a cycle. Another one is coming up. You don't want to disrupt that signal. Number 3, you have turmeric. Number 2, turmeric and black pepper. Number 3, we have the maca root. The picture of the maca root is going to come up shortly so that you can see it. The maca root, it balances estrogen and progesterone hormone. This is something that can help your hormone. This is the maca root. Please look at it very well. This is the maca root. Then we have the dandelion. Dandelion is also going to come up now. Dandelion helps in proper clearance of waste from hormonal activities. Also, as much as possible, it tries to bind itself with some of these xenoestrogens and help you to get a way out of it and reduce their effect. Number 5 is to take a garlic drink. Now, how do you do a garlic drink? You get 2 pieces of small garlic. You put it in a glass of warm water. Allow it to soak for 20 minutes and drink the water. I did not say drink the garlic. Drink the water that you have soaked in the garlic in. I did not say you should add ginger or add anything. Just drink that for 3 weeks. Once a day. You can do it in the morning, you can do it in the evening, but make sure you do not do it during your menses. Now, this information I'm giving to you, that is ruling you being in your best state. Not that there's something else, that there are some conditions that you have that you should not try some of all these things. So, please know yourself very well and know your circumstances very well. There are some conditions that you have that if you take this, it may aggravate it. For instance, if you're diabetic, if you're hypertensive, you have heart problem, if you have liver problem. So this is if you don't have any of all those problems. If you have cancer, don't try any of all these remedies. There is no remedy here that I'm giving you for cancer. This is for all these other conditions. So please take note. Now the second point, the second condition we're dealing with today is the PCOS, which is the polycystic ovarian syndrome. Now this is a disorder of the ovaries, which is caused by imbalance of estrogen hormone. You see, we just finished talking about the xenoestrogen. Now, the ovaries are the most important part of a female's reproductive system, I'm telling you. A woman can be circumcised and all the external part of the vagina will be cut off. She will still, it doesn't change anything. But if a woman's ovaries are removed, it takes a miracle for that person to be able to give birth. So they are very important. They are gray pink in color and of an almond size. You know your almond. They produce eggs and they produce hormones. Now, normally an ovary of a woman releases an egg every month. And if it does not get fertilized, the egg will mature out and drop out. And then the wall of the uterus will shed. And this happens every month. But in this polycystic ovarian syndrome, PCOS, the ovary does not release the egg, and it will lead to a cyst in around the ovary. So, you find out that in PCOS, there is what you call anovulation. That means that there is no ovulation taking place. What causes PCOS? There are several causes, but I'm going to give you the key cause. Several causes can be family history, sexual hormone pills, contraceptives, diet. All those things can contribute to it. But the number one cause of it is hormonal imbalance. Now, this hormonal imbalance will result in development of several balloon-like cysts. Now, the image of the PCOS is going to be displayed right away on the screen as I'm talking now, so that you can see what PCOS looks like. You see, the image of PCOS, you see a normal, look at the balloon-like structure image on the ovaries and look at the normal ovary. Yes. Now, this imbalance hormone that we're talking about we're talking about insulin imbalance in the body, progesterone imbalance in the body, androgen imbalance, and estrogen imbalance. So when we say hormonal imbalance, people always think about estrogen and progesterone. Insulin. Now, insulin is related to diabetes. Here you are seeing. You will see how all of them relate to one another. Remember, we have talked about xenoestrogen. When you are exposed to so much xenoestrogen, what happens? You will find out that PCOS is not far from the corner, because one of the things that xenoestrogen will do is that it will cause the person to develop PCOS, which is caused by hormonal imbalance, make the person have estrogen dominance. If you remember when I talked about that. Number 2 major cause, if it's not now estrogen, it's now going to be insulin imbalance. When there is a development of a chronic disease or any disease in the body, the first part of the body that gets affected is metabolism. And that's why this month of May, we're going to be focused on metabolism and the digestive system. The truth is that if your digestive system is not all right, you will not be all right. Now, it doesn't mean that you have ulcer. It's that the food that you eat, the things that you eat, how much of it does the body utilize? How much of it does the body use? If the body doesn't use it, there's going to be a problem. A disease will still form up. So when metabolism goes bad, the pancreas will also be affected. Now, this is why the pancreas malfunctions. Everything we eat is converted to sugar. You eat, if you like, be doing keto. For your body to use it, it will still break down that fat, break, and come down to sugar. If you eat sugar, it will still break down to sugar. If you eat only carbohydrates, your body can only utilize it when it is at the simplest form called sugar. And this is meant for our tissues and the cells of the body. If for any reason the cell receptors block the entry of sugar into the cells. Now, I've done a video. That video is free of charge. It's available. It's on diabetes. How diabetes forms. Please try as much as possible. When you finish, when you have time, go and watch that video. You will understand how your cholesterol affects your diabetes. Very important. I'm sorry, your sugar level. So, when there is a disruption, what happens is that this triggers the pancreas to produce more insulin, when in fact there is already existing insulin that is not being used. So when you have a case where something is mimicking the normal hormone in the body, what will that thing do? It will go and send signal that there's shortage, there's shortage, whereas there is excess. What happens? You have excess of insulin being released into the body, and then that affects metabolism. It affects metabolism. It affects, this circumstance now of having excess insulin will now cause a condition where the male hormone, androgen, will now increase. Now, when this androgen increases, it will also increase in fat and increase in cysts in the ovaries. You see how digestion can lead to cysts. This is the 2 causes. Any other cause you find, you see these 2, they are very important. Now, the symptoms of PCOS, there is acne, there is hair in the face, there is weight loss that nothing is reducing, there is mood swings, there is body pain, there is irregular menses, there is severe pains. Oh, the pains is a lot of pain. There is bone problem, there can be palpitation, there can be hair loss. The whole hair like this will barber off. You understand? So all these are symptoms. Now let's go to the things to avoid. For some of us, we already have this diagnosis. This information is learning for you. For some of us who are trying to prevent it, this information is learning for you. Whatever the case is, take these things I'm saying to you and learn from it. What are the things to avoid? You need to avoid excessive sugar, especially processed sugar from your frizzy drinks. You need to avoid barley. You see, barley is found in malt. The reason you are avoiding it is because of the impact it has on your digestive system, your metabolism. Corn flour, white bread, dairy products. Please, 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 please avoid these things. If you have a family history of someone that has cancer or someone that has fibroid, or pay attention to these things. These things are what you call triggers. They may not be a problem, but because someone's gene is exposed to this thing, these things begin to manifest problem. Now don't say, but this person is eating it, they don't have problem. The genetic problem they have in their family is not the same genetic problem that you are having. So please pay attention to this. Now, some of the things that you need to add to your diet. Now, these things I'm listening to you, they will help you to feel better. They may not cure it. I'm not going to deceive you. But you will find out that adding them to your diet will help any treatment you are doing to work much better. I tell you. And it will help you to lead a better life, as well as help you to prevent it. Now, basil plant. Basil has very strong androgenic properties, which helps in balancing the insulin. Basil plant is a plant, just a B-A-S-I-L. I don't think I have the image for basil because it's common. It also helps to reduce stress and help with weight due to PCOS. You see, you want to ensure that androgen is not much more. You see, so basil, get 1 leaf of basil. Put this in your teacup. I have a picture of a teacup here. Please, can I have this teacup so I can show you what the teacup is? Thank you. Yes, you see, this is a standard teacup. This is a tablespoon. Can I have teaspoon, please? This is a tablespoon. This is a teacup. So anything you are putting, you put it inside a cup like this. Don't go and carry a mug. Don't go and carry a jug. A small teacup like this is what you need. Okay. So you put 1 leaf in it. 1 leaf, not 10, not 20. 1 leaf. You put it. You are going to squash it. Put it in it. Put hot water. Allow it to steep for like 10 minutes. It will change color a bit. You drink it. Drink it every day. You need to drink it for at least 3 months. Now you do basil. That is one type. Cinnamon. Cinnamon is common. I don't need to show you picture. Cinnamon helps to regulate menses, also help with sugar level. You see, you can get a teaspoon of cinnamon, put in a glass of warm water and drink. So you can do basil this week, you can do cinnamon next week. Don't do basil and cinnamon the same time. You will have side effects. Number 3 is flaxseed. I think I should have a picture of flaxseed. If we can get a picture of flaxseed to display. Flaxseed is a plant, is a seed that restricts the secretion of testosterone in the blood and balances the androgen level. So what you should do is get a flaxseed, 1 teaspoon of flaxseed. 1 teaspoon of flaxseed. Thank you. This is a teaspoon. Teaspoon of flaxseed. You see? You crush it. You put it in your cup. Add warm water to it. I did not say you should cook it on the fire. Add warm water to it and drink. The next is your mint. Mint. Mint leaf. You can find these things in any shop that sells any of all these things. Mint. You see? Mint also helps in reducing the symptoms of PCOS, like hirsutism. You see, plenty hair. I don't have hair. I'm just showing you. You see women that have plenty hair. When you see any woman like that have plenty hair on her face, know that she's dealing with PCOS. You see? So it helps to balance the hormones in the woman. So how many leaves of mint? 4 to 5 leaves in your teacup. You see? And then you drink. Now your 7th thing that you can do is fenugreek. Fenugreek seed. Now both flaxseed, both fenugreek, they are all plants. They are all plants that have biodegradable hormone. You see? Flaxseed. Do we have a picture of flaxseed? This is not flaxseed. This is flaxseed here. That's flaxseed. Yes, flaxseed. Yes, that's flaxseed. Thank you. You can remove it. Thank you. That's flaxseed. Yes. Fenugreek seed. I was talking about fenugreek seed. This improves insulin resistance. So this flaxseed, mint, basil, you see, they help with the abnormality. They help to regulate it, ensure that it's regulated. Now, you soak your fenugreek. The first one is flaxseed. That you do not soak. Fenugreek, you soak 1 teaspoon of the seeds in water for 7 hours, and you drink and swallow the seed. Another thing that you can do for the pains is to get castor oil. You can find that in any pharmacy, castor oil B. Put castor oil, pour small on napkin. Put the napkin in your pelvic region. Get hot water bottle. Put the hot water bottle on top of the napkin. Don't put the hot water bottle on your skin, or it will burn you. Put hot water bottle on top of the napkin that has castor oil on it. You see? And leave it there 30 to 40 minutes. Now, you need to do this every night for 2 weeks, non-stop. Not as if you do it 2 days and say, I forgot. Non-stop. It will help the congestion in that area. Now, I need you to know that these remedies, I'm saying it again, please join your menses. Do not do them, so that you do not have extreme menstrual flow. Something that you need to add to your salads are beetroots. Beetroots are very rich in minerals. I didn't say you should do beetroot juice. Add it to your salad with lettuce, with cucumbers, with carrots, with cabbage, with tomatoes. Slice some, small part of it and add it to your vegetables. Now we'll go to hormonal imbalances. Now, hormonal imbalances are disease. This is a disease of the endocrine gland. The hormones are chemical messengers of the body, and they regulate the body's metabolism. They act like transporters, and they send signal from one cell to another. They usually travel through the bloodstream to the tissues and to the organs. Hormones affect different functions in the body, such as metabolism, such as your mood, reproduction, sexual function, growth, development, mental acuity. All these are controlled by the hormones. They are secreted by cells and glands. For hormones to function properly, they need cholesterol. That's why you find why xenoestrogen has affinity for fatty cells, because they have to be carried. Their functions are more effective in the presence of fatty cells. So when you say you're not eating oil, you are staying away from oil, your hormonal functions will be disrupted. I don't eat oil, I'm not eating this, I'm not eating that. Your hormonal function, if your hormonal functions are disrupted, your metabolism is disrupted, that means you are going to have a bigger problem. And there's nobody that has brought down their cholesterol. I can tell you, I've treated very many people by not eating oil. You need to eat everything, small of it. You see? Or look for natural source of it. When I even told you not to eat cow, I didn't even say don't eat chicken. I said make sure that the chicken you are eating is not the one that they have used hormone to grow it. 2 days chicken, they pump the whole life of the chicken. You don't find out that the person is eating it and is tasting one kind in their mouth, and they say, oh, they did not put enough spice. No, it's too much. It's too much hormones. Now, this deficiency of this fat and cholesterol in the body will cause hormonal problems. I already said that. So whether the level of hormone is low or high, whether if it is too low, it's hormonal imbalance. If it is too high, it's hormonal. It has to be balanced. If it is too low, there's problem. If it is too high, there's problem. No one is better. You see. So, what are the things that causes hormonal imbalance? Number one thing that can cause hormonal imbalance in somebody, especially in a woman, is stress. So, emotional stress. When you're in an environment where you are being beaten emotionally every day, you will have hormonal imbalance. I'm telling you the truth. Another thing again is alcohol, pollution, drug abuse, drug misuse, bad nutrition, thyroid issues. This can also cause it. When you are lacking essential minerals and nutrients, abnormal cholesterol levels in the body can cause hormonal imbalance. Now, what are the things that you can use for hormonal imbalance? You're going to see some of the image. We have pumpkin seeds. Pumpkin seeds, the image of pumpkin seed is going to go up now. Pumpkin seed should go up, please. Pumpkin seeds. Pumpkin seed is not ugu. Pumpkin is that orange ball. Yes, you see it. Yes, you can have the pumpkin. You can find it. It's everywhere in the market. You can even grow it by yourself. Pumpkin seed, yes. Striped cucumber. Number 2, striped cucumber. Number 3 is sunflower. This is now, if you look at this cucumber has plenty line. The line of this cucumber is very thick. I don't think this my picture is doing justice to it. Please go online and look for the image of and then striped cucumber is hard. The skin of it is very hard. It's not like a normal cucumber. It's a cucumber that you have to steam. They use it to make some of all these dishes. Go and look for that. If you're having hormonal imbalance, go and look for that cucumber. And it's very expensive. They sell it. If you go to my 12 market, you find it. If you go to my 12 market, if you go to market where they sell all this, they bring it from the north. It's in Nigeria here. I'm not even giving you what you cannot find. So go and look for it. Then sunflower seed. Sunflower seed too is something else. So these pumpkin seeds, what should you do? Add it to your meals. Don't roast it. You can find some of them in supermarkets, but they would have been over salted. So buy it, boil it, eat it, eat as much as possible, add it to your breakfast, you can add it to your oats, or eat it by themselves. Ensure that you eat a lot of it. Striped cucumber, use it to make your fish sauce, use it to make your vegetables. Instead of just cutting ugu that they have used this thing to fertilizer to punish, go and look for striped cucumber. Slice it, dice it into cubes, use it to make your sautés. Ensure that you have as much of it. Remember that it is natural therapy. It's not as if after 2 days you'll be checking yourself, has it gone, has it gone? You need to do this, take this, add these 3 things I just told you so. Add it to your diet. Do it for at least 3 to 4 months. Now, don't wait to have irregular menses to do these things. Abnormal hormones to do these things. Yeah, this is a better image of this striped cucumber. You find it. The flesh of a striped cucumber is a bit tough. It's hard. It's like crunchy. You do crack, 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 like carrots. That cucumber is like carrots. If you break it, it's not like normal cucumber. So, enough of that. Let me move down to menstrual irregularities. Now, this is a disease of the female reproductive system. Menstruation is bleeding through the vagina in females, and this bleeding occurs every 28 days. This is normal. Now, normal bleeding should be between 4 to 6 days depending, and that is normal, and it is pure liquid blood. There should be no clots in it. When you are finding clots in your menses, that is an abnormality. There's a difference between a clot and a tissue. Sometimes some tissues, some small tissues will come out, but a clot is a lump of blood. That shows that there's something else going on. You should go and do a scan. Menstruation usually occurs from puberty to menopause, except during pregnancy and while breastfeeding. Some people, during their pregnancy, you should not be menstruating during pregnancy, although in some cases it happens. You should not be breastfeeding. You should not be menstruating during your breastfeeding. In some cases, it happens. So when there's an abnormality in this cycle, then that means that there is a disorder. Now, there are different types of menstrual disorder. We have amenorrhea. I'm not seeing my menses. I've not seen my menses for 7 months. I've not seen my menses for 1 year. I've not seen my menses for 2 years. That is amenorrhea. Hypomenorrhea. The menses is coming up, but it's very, very tiny. Tiny menses. Some people just have a drop. Thumb. That is very small. Then we have oligomenorrhea. This is menses that is very irregular. Now, an irregular menses by definition is any menses that the cycle is more than 35 days. It's irregular. So if your menses comes every 35 days or every 40 days, that means you have irregular menses. If you count how many menses you are having in a year, it means that your menses is not up to 12, because you should have 12 menstrual cycles every year. If you are having 17, 18, 19 menses in a year, that means in a month you are bleeding twice, some people 3 times, some people non-stop. That is also an abnormality. That is called menorrhagia. Menorrhagia is heavy and prolonged menses. This person has been menstruating, like that woman with the issue of blood in the Bible. She has this condition. You see, that is prolonged menses. So some people are menstruating for the next 5 months non-stop, 1 year non-stop. They took a drug, after which they did a procedure, after which they ate something, after which these things are just there non-stop. There's a disruption in the natural process. Dysmenorrhea, that is another abnormality, which is excessive, painful, very extremely painful menses, accompanied by cramps, sharp intermittent pain, dull aching pain, usually in the lower pelvis. Now, there should be occasional pain for some people. Some people don't even have experienced any pain. But dysmenorrhea is not normal. So you need to find the cause. Sometimes infection can be causing it. Sometimes an obstruction can be causing it. You know, you need to find out. Some, like those different fibroids I talked to you about, they can be triggering this pain that the woman is feeling. Now, what are the symptoms of menstrual disorders? Now, whether it is oligomenorrhea, whether it is dysmenorrhea, whether it is absent, they all have symptoms. But the symptoms are cut across all types of disorder. I'm going to list them to you. Number 1, you have nausea, weakness, tiredness, irritability, headaches, dizziness, pain, clots in the blood, leg pain, back pain, fainting, difficulty sleeping, bitter taste in the mouth, fever. Sometimes, all these are signs of symptoms of menstrual disorders. Now, what are the causes of menstrual disorders? Tumors. I've talked to you about fibroid can cause it. Excessive smoking or secondhand smoking can cause you to have menstrual disorder. Liver diseases can cause someone to have menstrual disorder. Kidney diseases can cause someone to have menstrual. Polycystic ovarian syndrome can cause someone to have menstrual disorder. Chemotherapy or other kind of therapy can cause someone. Drugs that someone is taking for medical purpose can cause someone to have menstrual disorder. Endometriosis, depression can cause someone to have menstrual disorder. Hypothyroidism or thyroid problem can cause bad eating habits. When you are not eating well, your menses will be very scanty or your menses will not come. Because share the body that have not seen food to eat, is it the one that will share that's blood that you will? So in time of malnourishment, malnutrition, your body is not going to be shedding off nutrients. It will hold on to it. So before you want to find out what is your lifestyle, your nutritional lifestyle. What is it? Are you just eating what you feel like? Is it what your body requires? Are you deficient in calcium? Are you deficient in some minerals? You need to find out. It's not to go and be drinking supplements. I do not support supplements in any way. So I always tell you, you run tests. If you do your mineral analysis, your blood test, it's not that one that they will go and hold machine and say your blood work. They will take your blood. They check your electrolytes, your mineral levels. You do this test. They would know if you are deficient in some of these minerals, you may not menstruate or your menses may be irregular. Now, if menstrual disorders are not treated properly, it can lead to infertility, it can lead to uterine cancer, it can lead to osteoporosis, and it can lead to premature menopause. So that your scanty menses, you didn't do anything about it. You just wake up one day, menses will not come again. You just enter premature menopause. Sometimes too, prolonged grief, loss of a loved one, grieving for a long time may make someone to have menstrual disorders. So it is recommended, I'm saying it again, join your menses no matter what it is. Do not take any type of remedy at all. Now, treatment for menstrual disorder. This covers all the type, whether it's scanty, whether it's, So, betel leaf. The image of betel leaf is going to show up. So you take one leaf of betel, one leaf, put it in a teacup of water, hot water, allow it to stay, strain it. This is betel leaf, yes, strain it and let it cool. Thank you. You can take it off now. You have carrots, sesame seeds, pineapple, avocado. Ensure that you have a lot of all these things. Pawpaw, precisely unripe pawpaw. How do you do the unripe pawpaw? Take unripe pawpaw, put it inside, cut a small, like 1 or 2 slices, put it inside, cut it into small chunks, wash it very well, don't peel it, put it inside a cup or a bowl, like 2 glasses or 3 glasses, and then you allow it to soak for like 6 to 7 hours. You remove the seeds and all that, throw it away, and then you drink the water. Drink it every evening for 3 months, non-stop. You cannot be drinking pawpaw, then you go and drink betel. You choose one you want to do. Mint is another thing that can help you. Your mint leaf, rose leaf, rose tea, roselle, what you call zobo. That's something again that you can add and drink. These are things that can help your body. Bamboo shoots. Please show the image of the bamboo shoot. Bamboo shoots. Please get premature bamboo shoot. Yes, the small one that is coming out. Yes, you peel it off. You peel it off. Thank you. Peel it off and put it in your cup. You can even make it. You can use it to make like your yam and sauce and all that. Add it to your diet. Celery. Celery is a vegetable. You can find it. Add it to your sauces. Onion. Now you should eat raw onion. If you're having any of all these menstrual disorders, eat raw onion 1 week to your menses. You know, take raw onion, take it, and I'm sure you have a very, very good experience. Aside from it entering your eyes, 1 raw onions every day, 1 week to your menses. After that, you stop just once in a month. Now, another thing you can do is eat aloe vera. Aloe vera. Now, how do you get your aloe vera? There are different species of aloe vera. Get the real edible aloe vera. Cut this from the center. Take out a teaspoon. Mix it put it in a teacup. Add a tablespoon of honey to it. Add a little water to it. Drink it on empty stomach for 9 to 10 weeks. Take note of the duration, 9 to 10 weeks. Not as if you are taking it forever and ever. Now, let's go to menopausal symptoms. I believe you are learning, you are hearing from me. Of course, this is an on-demand video on demand, so you can watch at your pace. And but I want to believe you are learning. If you have any question, you can drop it on the group. Menopausal syndrome. Now, menopause is not a disease. Menopause is not a disease. It is a natural process. The end of menstruation is menopause. The ovaries release a number of eggs, and the hormones estrogen and progesterone. They release a number of eggs, and the hormones, which is estrogen and progesterone. Now, these 2 hormones, they regulate menstruation and ovulation. In menopause, the function stops permanently because they have reached the stage. They are no longer releasing eggs, and the woman has become infertile because of menopause, and production of estrogen has reduced. Now, one of the responsibilities of estrogen is regulating breast development, helps to maintain the bones, and helps the heart in the female and all that. So in menopause, normal functions, aging has come to pass. The effect of age is already coming to play. Menopause, like I said, is not a disease. It is a stage in life. And so what are the symptoms of menopause? People who are in menopause, they know. Sometimes they do not even know that the symptoms they are experiencing is as a result of menopause. Palpitations, insomnia, joint pain, back pain, irritability, decreased sexual libido, mood swings, hair loss, vaginal dryness, tiredness, unexplained outbursts. They can just be crying for no reason, or they can be angry for no reason. Some of all these symptoms are things that people experience. High blood pressure. Sometimes it has also been found that sometimes the female can have this complaint. Now, what are the treatments for menopause? Number one treatment for menopause. If you are experiencing menopausal syndrome, one thing which many of the women who are in menopause do not do, they say, I don't want to do that anymore, is sex. Especially if your spouse is still alive, please try as much as possible as women who are in your menopause to have sex, engage in sexual activities. Now, during sex, what happens is that your body releases quite a number of hormones, and some of these hormones that are released will help to cause relief of the symptoms that you're experiencing, especially if your blood pressure is not going down. If you are a woman in menopause and your BP is not responding to any treatment, please go and have more sex. Number two that you need to add is grapes. Grapes. You know, vine grapes, those are small grapes, yes. Add beetroot to your salad. But there's something else I want you to add into your teas or into your routine, which is fennel seed. Please, can the picture of fennel seed be shown? If you can find this. Now, this is it. Yes, thank you very much. I have seen cases where women who are in menopause drink fennel seed and their menses came back. So please, drink it with caution. Just take a little of it for a short period of time. It's not something you don't now put your whole life on. No, just take a little and, your menses will come. Your menses must come out if you use it. I don't use all these things I'm telling you are not in any of my formulations. My formulations are put together to do something. So these are things that you can do by yourself, So, but take note that if you are having very high level of menses, your menses are flowing too much, stay away from fennel seed. If not, your flow will be too much. Scanty menses, in addition to those things I've listed, you can try this. But if you are experiencing, especially all those bone pain, all those complaints associated with menopause, fennel seed is your go-to remedy. Another thing that anyone experiencing menopausal syndrome should do is bitter leaf. Have bitter leaf soup, bitter leaf salad. Yes, you heard me well. You chop your bitter leaf, add it to your lettuce, add it to tomatoes, add it to carrots, add it to you can even put some shredded fish or meat inside of it, bitter leaf, add it to it. It's very nice. Don't add any mayonnaise or anything, mix it together, eat it by itself like that, or you can have bitter leaf and okra soup. You are not going to wash the bitter leaf off. You will slice the bitter leaf, slice the okra, put it in your fish, and make it into like okra and eat it like that. It's very nice and you will find a lot of results. Another thing again is guava. Guava is a fruit. Guava has leaves. You can eat the fruit, you can have the leaf. The way you do your better, 1 leaf of guava, add it to your teacup, drink it every day for 1 month, or as you get better, you stop, you can drink it. You just add it to your routines. Some other fruits you can add that helps people who are in menopause are peaches, pomegranate, and passion fruit. There are several other fruits, but I'm telling you the one that when you do it within a period of time, you will see results. So that's it. Now we move on to the next topic, which is vaginal disorders. Females have vagina. Vagina is a muscular and sexual organ in a female, and this is a part of the reproductive system. Now, the vagina has different tissues, and they help to secrete fluids and keep the wall moist. They are elastic, and when there is healthy, there should not be any odor. Your cells of your vagina are responsive to the hormone estrogen. Actually, you are seeing again estrogen. So if your estrogen level is not all right, don't be wondering why you are having dry vagina. So when you have bombarded your body with xenoestrogen, you will now find out that you will be having problem with your sexual life. You see, that's why I'm encouraging women who are in menopause that their husband is still alive, or even if they are not planning to marry again, it's fine. But if you are planning to marry, please marry and get somebody to have sex with. So many of your complaints you are having, you will not have it again. I'm telling you. So now let's go to. So I've talked briefly about the vagina because I have quite a number of things to go. My slides are still quite a lot. atopic vaginitis. Now, this is a condition that occurs when the body produces less estrogen. This less estrogen can be as a result of menopause, can be as a result of other conditions that we have mentioned in the past. Anything that affects estrogen level will affect the vagina. So here you can see that while the person is battling with estrogen problem in fibroid, it's already battling with atopic vaginitis. While he's battling with PCOS as a result of estrogen problem, is battling with atopic vaginitis. So atopic vaginitis is a condition that occurs as a result of less estrogen in the body. And the symptoms are vaginal dryness, burning sensation while urinating, burning sensation in the vagina, bleeding following intercourse, bleeding in between period, genital itching. And now this condition is not contagious. It's not an infective condition. There's also what you know as vulvodynia. This results in pain. Some people just have pain. The pain is around the opening of the vagina. This pain will just come. It's very sharp, painful pain. It can come and it will go like that. And this condition does not have any treatment scientifically. But if people come to me for vulvodynia, I don't even give them treatments. At the end of this, I will tell you what to do for any of all these vaginal conditions. Then we have the bacterial vaginitis, which causes gray or whitish discharge, which is very foul smelling. The persons will urinate, the place will be smelling as if where they are doing ice fish. Very foul smelling, itching or pain in the vagina, strong fishy smell. And this smell will come most usually after sexual intercourse. Now, you cannot pick up bacterial vaginosis from toilet seat or sharing toilet or all that. But if you are using sex toy, you can share it. You can share it. If you are doing oral sex, you can share it. And your partner can pick it up. I think the video has stopped. What happened now? What were you doing? You just check your phone. You know they look. I hope it's not recording. Eh? The both of you are here. What are you doing that the thing is? What kind of color is this? And my legs are showing. I hope all that part is not showing now. Eh? The both of you are checking. You're not, what are people checking now? You say what? Sorry for the break in transmission. So I was talking about that, but I was talking about bacterial vaginosis, and I said that it can be transferred using sexual toys, and it can be transmitted from one person to another, even though you cannot pick it up from surface. The next condition is the yeast infection. Now, this is also known as candidiasis. It's caused by the fungus known as Candida albicans. Now, the symptoms of this is cheesy yellowish discharge. There's irritation, The odor is like an alcohol. It's extremely uncomfortable, itching sensation on the vulva and in the vagina. Now, there is research that has shown that having oral sex is one of the leading causes of Candida albicans in women. Also, resuming sex after a long period of abstinence can lead to yeast infection, and yeast infections are not considered to be sexually transmitted infection. So a man will not pick it up, but you can pick it up from their mouth if they have the fungus in them. The next infection is caused by parasites. This is called trichomoniasis. This is caused by Trichomonas vaginalis. Now, this is a parasite, like a bug, like a bug, yes, that finds its way into the vagina and causes symptoms like redness and soreness, itching and burning sensation, discomfort when urinating, abnormal green, yellow or gray and bubbly or frothy discharge. The characteristics of trichomonas is that it's frothy, you know, and then it's greenish yellow. For chlamydia and gonorrhea, when we get there, you find their colors, but this is greenish yellow. Now, this is a sexually transmitted infection and it can be transferred from one person to another. Now, HPV, human papilloma virus. This is an infection that results in warts on the genitals or on the skin around the genitals, depending on the type of strain that has been contracted. There is no symptom at all, and this person can carry this infection for many years, no symptom, but it will cause problem in them. Now, HPV is the most sexually transmitted infection, and so one way to know is by running tests. I'm going to talk to you about laboratory tests to do. Genital herpes. This is caused by herpes simplex virus 1 or 2. Now, these herpes do not produce any symptom, but sometimes the people have sore around their vagina, around their mouth, around their rectum. You know, so when you have a partner that is having sore in his mouth, don't allow him to put his mouth in your vagina area. Genital herpes is a sexually transmitted disease. Even when the person is not showing any symptom, it is still contagious. We have gonorrhea. Gonorrhea is caused by Neisseria gonorrhea. The symptoms are yellowish or green, very deep green discharge and excessively cloudy urine. You know, it looks as if there's egg, like you break egg white inside your urine. There's pain while urinating, there's unusual vaginal bleeding, there's pelvic pain. Now, when gonorrhea is not well treated, it will lead to condition known as pelvic inflammatory disease. We're going to get into that sometime shortly. Chlamydia is another bacterial infection. This does not produce any symptom. Chlamydia is the second leading cause of infertility in women. It is a sexually transmitted infection. If you are trying to conceive, it's important that you pay attention to chlamydia and check to be sure that you do not have chlamydia. It is caused by Chlamydia trachomatis, and it doesn't produce any symptom, but occasionally it can produce the symptoms that I've mentioned to you. Now, when someone has chlamydia and gonorrhea or any of all these infections that have stayed, or a combination of all these infections that have stayed for so long, what happens is that these organisms, they move from the vagina, they move to the cervix. They move from this cervix, they move to the uterus. They move from the uterus, they move to the fallopian tube. They move from fallopian tube, they move to the ovary. You see, this is how they migrate. As their journey, they will go to the pouch of Douglas and go and relax there. They will now begin to form pores because they are pores-forming bacteria. They will now cause plenty of pores to be formed in the pouch of Douglas that comes out as abdominal discharge. The woman will be experiencing discharges. The discharges are very smelly. The discharges are very putrid. Non-stop discharge. Sometimes this discharge is very hot. As it touches the vagina like this, it will be burning them and peppering them because the bakery is at the pouch of Douglas. You see, now they're going to show you an image of a pelvic inflammatory diseased organ, and versus normal one. You see the PID now. Now, this is a disease of the reproductive organ, yes. You see the inflammation. The picture is not very clear. Please manage it. You see, if you look at a diseased one, if the picture was clearer, you would be able to find the way the patches will be inside. These things I'm describing, this image is not showing. But you can go online by yourself and check for PID. Check PID images. You will see healthy vagina, healthy pelvis, and pelvic organ that has PID. You see how it spreads. Now, this PID, what are the symptoms of this PID? The funny thing is that these bacteria, they find a way, they are able to manage to, so you can take off the image now, thank you. These bacteria, they are able to cause inflammation of the lining of the stomach. So you see how PID will go and affect the stomach. It can also cause inflammation of the liver. If the muscles that help breathing can get weak, it can cause pain in the upper abdominal region that will make you think you are having ulcer. You be treating ulcer. You using ulcer medicine. No, pain now down here. The problem there. The pain upper abdomen here. There can be pain as you breathe in, breathe out. In fact, the symptoms of PID that I've just mentioned to you now, can you see that it's not showing you that the problem is inside from the down below. And that's why a lot of time people have PID and they are not aware that they have PID. They will be treating malaria frequently because they will be having fever, chills, headaches, tiredness, bitterness of the mouth. These are signs of pelvic. The funny thing is that by the time you are having discharge, the bacteria has not ascended. As they are ascending from the vagina upward, as they get to the neck of the vagina, which is the cervix, the entrance of the cervix into the vagina, they move to the pouch of Douglas and go and stay there. Once they get to the pouch of Douglas, you stop having discharge. Now, this whole thing I've described to you may be like maybe briefly a week or 2 weeks. They have moved. They have moved, or you use something, the thing just make them to weak. They didn't die completely. They move to the pouch of Douglas and go and stay there. Then they ascend, they spread, they send some to the uterus, some to the tubes, some to the ovaries. They will spread everywhere and cause big problem. While they are journeying up and down, they will find a way to pass through the membrane and find their way to the stomach lining, find their way to the liver, find their way around your lungs, find their way to your face, and go and cause you bad acne. You will be thinking you are having PCOS. You will not know that it's PID you are having. So, PID is a silent modern day killer, and that is the number. So we talked about chlamydia as the number 1 cause of infertility, number 2 cause of infertility. Then apart from hormonal related issues, then we now have pelvic inflammatory diseases. When there is PID, what happens is that plus the uterus, plus the fallopian tubes, plus the ovaries, plus this everywhere is infected and is inflamed. So when you have sex, proper fertilization cannot take place because those bacteria will fight the sperm cells. The one that managed to survive fighting bacteria will not survive hatching egg. If he managed to hatch egg, he will not survive implantation. If he managed to survive implantation, the presence of the bacteria there, they will go and choke it. You know, like a weed. When you plant something, if you don't remove the weed will choke it. Exactly what happens in the case of PID. These different microorganisms, they will just be there, and one person can have different types of infection at the same time. Can have yeast, can have chlamydia, can have gonorrhea, can have trichomonas, can have all of them. Now have estrogen problem join. You see that the person will be going from one place to another. The person will use drugs, look as if he's getting well. After a while, the problem will come back again. Effective treatment of PID It's not a 1 week or 2 weeks or even a 3 months therapy. You need to treat it very well. It will drain. You go through a process where there will be draining. The body will drain off all those things. Then, when you finish draining, remember as you are draining, you are passing out some of those active bacteria. You need to be careful not to reinfect yourself. Because it's very possible that people can treat themselves for a particular bacteria. While they are doing that treatment, they have reinfected themselves again. You have a partner. As you are treating yourself, is your partner treating himself? Your panties and your linen, your bed sheets, those are things that can have the droppings. Remember that bacteria don't die. They have been in existence since the creation of this earth. They don't die. And the bacteria have work that they do in your body. The only thing is that they have moved from a location to another location. And when they find themselves in that location, they are causing problems. So you cannot completely remove bacteria from your body. You need them. Your vitamin K is produced by your colon. It's produced by activities of bacteria in your colon. Otherwise, you will not have the anti-clotting agent that prepares your body, clotting agent rather, that prepares the body from excess bleeding. You see? So, how do you prevent reinfection? When you are treating yourself for any infection, you need to disinfect your mattress, your everything you use, disinfect. And how do you do it? Simple, just get jig. Any bleaching agent, 99.9% hypochlorite. Put it in a spray bottle. Dilute ratio 1:1. 1 cover to 1 liter. That is, you pour it inside the spray bottle. Spray it on your, you see your chairs, spray it on the chairs. Just chairs like this, spray it there. Spray it, clean very well. Your mattress, spray it on it. You see? Then your blanket, your towels, all those things, put them in very hot water. Very, very hot water. Or use, if you're using machine, use hot. Even if it is not white color, put it in white. Let it cook, let the machine cook it very well. Pack it and go and sun it under the sun. When you go and sun under the sun, pack it before evening. Some people will wash clothes and leave it outside. There are bacteria on the ground, there are bacteria in the air, there are bacteria everywhere. So when you sun under the sun, during the sun, they remain inactive because they are dried. But when you leave your clothes there and breeze blows something from blow it on your undies, then you now leave the sun has gone down. There is now the weather, atmospheric weather is now calm. Some moisture in the air will drop on it. Any breeze that blow any bacteria on your pants, they become active again. You carry it inside, you go and wear. Second set of people are people that hang pants inside toilets. Please hang your pants outside. Let sun heat it very well. Then pack your pants and put inside your undies bag. Don't keep pants that is not very well dried. Don't keep it inside your storage bag. Don't mix it with one that is dry. All this moisture, bacteria like moisture. Then your sugary things that you are taking, bacteria like sugar, they like enjoyment, they like sweet things, and they can cause cravings. One of the ways to know that you have infection, vaginal, is that you're craving for sugar. The bacteria that is inside the pelvic cavity, they will drive cravings that you just feel like eating ice cream, you just feel like eating sugary things, you just feel like drinking malt, you just feel like you'll be satisfying the craving of those things. It's not you that is craving it, it is that thing. So if you find out that you're always craving, you need to deworm yourself. Proper deworming. Because if you have a parasitic infection, sometimes those worms too, they can cross over from your anus and cross down to your vagina. Especially when you pass gas, you release very many of them. Some of them will just throw. And then those of you that don't shave, these bacteria, they will climb the air, pass, go inside. The place is conducive. The weather is habits that you do. I just finished talking about your disinfecting, how to prevent reinfection. Disinfecting your things, your mattress, your towels, your everything, disinfecting the course of your treatment. Wash your toilet twice every week. Twice every week at the minimum. Wash with jig, wash with bleaching agent. Wash it very well. If you have to share toilet, spray jig on it. Spray something that is, then rinse it off. Don't sit down on ordinary jig. Rinse it off. You see, all that. Have a towel that you use for your body, different from the one that you use for your face. Very important. When you clean your body, when you are having your bath, don't doge. Don't be putting your hand inside your vagina don't doge. When you do that, you affect the pH of the vagina. The vagina is supposed to be acidic. Why? So that when some of all these microorganisms try to pass, it's supposed to be too hot to burn them off. But oh, you want to have what now? You will now be putting your finger to rinse every minute. When you do that, you destruct the pH. You wash with soap. Don't wash your vagina with soap. Use ordinary water to rinse your labia. That's all. Just rinse and don't put your hand inside. And don't insert anything inside. Except it's a medicine. And even in doing that, ensure that what you are using to insert is clean, properly clean. Some of you use vaginal suppository for treatment. Ensure that that thing you are using to push it is washed properly and properly kept. You see, don't leave it where God gecko and different things have climbed on it. You now insert it inside. You now be wondering why the treatment is not going. So you must take measures to prevent reinfecting yourself. Next thing you need to do in the course of your therapy, in the course of your treatment, is to ensure that you finish the course of the treatment that you are doing. Don't forget it. Don't say that you have used it for a while. If you forget it, the thing will come back again. So ensure that you finish. Now, suppose you find out that you have some of all these infections I've mentioned to you. So I'm going to give you a garlic therapy. Now, this garlic therapy is going to help you drain the bacteria that are stored. It may not help you remove all the effects of the bacteria that are spread to your whole uterus and all that, but it will help you. It will go a long way. You see, it will go a long way to help you. Now, one of the things you're going to do is garlic insertion. How do you do a garlic insertion? Although I have a video on PID on YouTube, but I will still tell you. So what you can do is you get a sizable garlic, you puncture it, wash your garlic very well. You first of all wash your hand. Wash your hand with soap and water. Peel your garlic, rinse your garlic very well. Use a sterile or new pin. Puncture your garlic, put holes around it, not very big, just puncture it. Squat. Last in the night, after going to the toilet, you having your bath, everything, squat and insert the garlic into your vagina. Do that every night for 7 nights only and stop. You're going to find out that it will help. What the garlic would, allicin in garlic is going to stimulate the walls of the vagina, stimulate when you put the garlic, you will feel the taste in your mouth. If you stop tasting the garlic in your mouth, know that it has dropped off. So you will feel the taste in your mouth. So it will drop. You know, in the morning once you go to urinate, to sit down in the toilet, it will fall off. If it doesn't fall off, just use your hand to bring it out, or you can tie small rope inside. But it's not anything to come out by itself. It will come out. You will not be feeling the taste in the mouth. Your body will push it out as a default. Your body will push. Nothing like it lost. It cannot lose. It will come out. Nothing can lose there because it is a self-cleansing. So when you do this garlic insertion, what are you doing? You are stimulating the walls to be more responsive. Then you are making the pH and then the temperature in that area to be as hot as it should be, to make bacteria uncomfortable. They will pack their load and run out. So you may find out that you are draining more, you have some discharge. Don't worry yourself. Now, don't have sex. If you are doing a treatment for infection, do not have sex during that treatment. Pause. Finish your treatment first. Go back and do tests. So, one of the ways to know if you have a pelvic inflammation disease is a pelvic scan. Go and do a scan. A scan, it will tell you that you have a PID. You can do a vaginal swab. So a high vaginal swab means that they will put a swab deep into your vagina, through to your cervix, take a lot of samples from it. They will run it into culture. If it has chlamydia, it will show. If it has gonorrhea, it will show. Whatever it has, it will come out. They will run it through different strains. It will come out. After the culture will come out after some days. You can do blood tests too. There are tests to check for syphilis in the body, and some other bacterial infection. The next thing that you can do again is onion therapy for 2 weeks. You get a very small sizable onion. You pound it, not blend. Pound it pound it, pound it, pound it, pound it, pound it, pound it till it's smooth. Add boiling hot water inside the mortar, and then allow it to stay till it will steep for like maybe 5 till it will look warm. You sieve it and you drink morning and evening every day for 2 weeks. I tell you, when you drink it, you will have a lot of discharge. This is going to help you to empty the pouch. So what this therapy is going to do for you, it's going to empty your pouch of Douglas. This will help you certainly, but this may not be enough depending on how long you have been having the infection, depending on the kind of infection that you have had, depending on the effect that the infection has caused. You see? So if you are having PID and you are trying to conceive, please book a consultation. This will help you. This can help you conceive. It may not just be enough. So I'm not holding anything. Then I'm going to introduce you to 2 herbs. One of them is Lily of the Valley. You can look at it. This is a herb that you can look for. Lily of the Valley. When you are singing, you are the Lily of the Valley. There's a Christian song like that. Lily of the Valley. This is Lily of the Valley, yes. You see. So you can get it, make it as a tea and drink. Another herb again is Echinacea. Echinacea is a very strong herb. I do not advise you to drink Echinacea just like that, but Echinacea is a very good antibiotic. I can tell you any day, anytime, if you use Echinacea, but you must know how to use it, and you cannot use Echinacea for more than 14 days, so you do not have side effects. Now, don't be deceived that plants don't have side effects. Everything has side effects, including water. Now, let's move on to the next condition, which is loose vagina. Now, loose vagina is not a disease. This is a condition where the vagina loses its elasticity and becomes slack all the time. The vagina is an elastic organ. It's a muscular organ, and it expands to accommodate the penis and child during childbirth. And it's supposed to return back to its original shape. But sometimes they do not return. There are different causes of loose vagina. One of them is rape, violent sex. Childbirth can be a cause of loose vagina, especially very many childbirths. Episiotomy, which is a tear that is given during childbirth. Masturbation with very large objects can cause that. Repeated sexual intercourse with very large partner or multiple sex at the same time. There are people who do threesome, 3 men having sex with the same one woman. That can cause you to have slack vagina. Initially, it may be interesting, but going on after a while, you can have loose vagina, and then you begin to look for what to use to tighten it. So, what are the things that you can do? So, what are the 3 simple ways that you can use to tighten your vagina? There are 3 ways to tighten your vagina. A tight vagina gives pleasure to both partners during sexual intercourse, and a loose vagina will rob both partners of satisfaction and pleasure. What are the ways to tighten vagina? One of the ways is surgery. Now, surgery may be indicated in cases where the woman has very large structural deformity, like I said, from violent sex. You know, we've had cases where people have been raped and some objects were used and all that. They caused a lot of damage to the walls of the vagina. Those can be reconstructed by surgery. Another case again is VVF. That is when a child vesical vaginal fistula. That is another condition entirely. You know, but in fact, that is a very, very bad case, and it is only surgery that can be done in that case of VVF, because there is not only damage to the vagina, there's also damage to the bladder. There's an opening between the vagina and the bladder, and so urine is leaking into the vagina. So the woman is urinating through the vagina. You know, so it's a very bad situation. That is also surgery can help. Exercise can help. I know people are not interested in exercise, but exercise can help. If you can have the picture of the Kegels exercise, that is an exercise. Can we have the picture of the Kegels exercise, please? Now, the Kegels exercise is an exercise that shows you, the image is going to show you, it's something you can do by yourself in your house. You would have even seen some people, they will lie down between their legs, open, close their pelvis. This helps. It's not as if you do it 2 days and say it didn't work. You need to do it and do it consistently for a period of time. Kegels exercise, you hold your pelvic wall, hold like as if you are holding in, then you hold in for 15 minutes, you move your legs up and down, up, you know, open and close, open and close, open and close like that, and then you release. Then you do that repeatedly like that. Do that repeatedly, you know, that can help you. Now, herbs. So that is there's the exercise. I've talked about the Kegel's exercise. I've talked about surgery. Now I'm going to talk about herbs. Now, these herbs that I'm going to show you now, they are herbs that can help you to tighten the vaginal walls. I don't have any formulation for vaginal tightening because it's not a condition that is a sickness. I only deal with sicknesses. So I'm just going to tell you some of these things. You can make them together by yourself. Can you show the Kegel's exercise? If you can find it, yes, this is Kegel's exercise. Yes, that is it. You see the exercise. You hold yourself as if you want to wee. Hold very tight. You lock up. When you lock up, you do like that, like that. Thank you very much. Now let's go to the herbs to tighten vagina. Number one is Curcuma comosa. Please show the image of Curcuma comosa. It is not the same thing as the one we have shown it to you. This is Curcuma comosa. You see it? Can you look at this? Is not ginger. Curcuma comosa. Thank you very much. You can remove the image. The next is Purerea mirifica. Now, I don't want to tell you what if you do, it will not work for you. These two things I'm telling you so. If you do it, we have tight vagina. This is Purerea mirifica. You have to settle down and go and look for it very well. You need to look for it very, very, very well. Yeah. So you can take this Purerea mirifica. You see like it's a root. You grind it. When you finish grinding it, take teaspoon, be drinking it, be drinking it, be drinking it. I'm telling you, it will tighten up. You can use to do seeds bath, but don't allow it to enter inside though, because it's a bit pepperish. Same thing for Curcuma comosa. Now you can mix both Curcuma comosa and Purerea mirifica together. You can now add honey to it and drink it. You see all those your tightening, all those tightening cream that they are selling for you. I just told you the ingredients of most of them. This is the active ingredients. These two plants are the two plants that science has shown with studies that has the ability. Because you know why? These two plants I just told you, they are very high in estrogen. Remember that the walls of the vagina respond to estrogen. So anything that is high in estrogen, the walls of the vagina will respond to it. That is why it will work in tightening vaginal walls. So you get it. I don't have it as a formula. I don't do vaginal tightening cream or tightening rub. Put these two things together inside honey and drink. Don't insert it. Oh, it will pepper. It's very pepperish if you put it inside. But if you drink it, it's not pepperish. So mix your own and have it. And I did not give you formula to go and use to produce and be selling to people. Remember, you are not a doctor. This is not a training that you now say you have now trained. You are not a gynecologist. If you go and do it, you are a quack because you don't have license. So do it for yourself. Do it to help yourself. Now, number 3 thing that you can do that is not very nice, but you can do that will help you is aloe vera. Eat aloe vera with honey. Ensure that you eat aloe vera. Then something that I wanted to talk about, very interestingly, mangoes. Mangoes are very good in vaginal wall tightening, yes. And then they help the vaginal wall secretion. For people that have oral sex, in fact, if someone paid me plenty money, not be small money. Let me tell you how much person paid. Person paid me 2 million naira for me to help her find, do a study on what will make her vagina. According to her, she said she wants her vagina to taste better because she wants her husband when he does oral sex. So I did some studies, and mango, eating a lot of mango, eating a lot of pineapple. Now that mango is in season, eat plenty of mango. I'm telling you, your secretions, all the cells of your body will taste different. I'm not permitted to give you, I mean, it's more money you paid for this class now, but it's still worth it. You know, but I'm telling you that mangoes are very good. Then something else that I need you to use to do seeds baths is called tamarind. Please show the image of tamarind. Tamarind is found everywhere. Just see the image. I don't know what the local name is, but it's called tamarind. You can find it. It's everywhere. Most of the things I'm telling you are things that you can find in Nigeria. So, tamarind. Tamarind looks like granite, but it's not granite. You know. You will boil tamarind, you make it to make tea. You can even eat it. They used to lick itself. But I want you to do tamarind bath, seeds bath. You will take the tamarind, put it inside the bucket of hot water, boil it. It will change color, it will change to like chocolate color. You will now sit down inside it. Not when it is very hot. Oh. That's not how to do seeds bath. You sit inside. It will warm up that whole place like this. Everywhere will be to tighten it for you. Have you seen the picture of tamarind, please? Because when you find it, kindly post it. I need to run along. Now, 12 foods to improve your vaginal health. Walnuts. I need you to eat walnuts, at least 10 pieces of walnuts. Try as much as possible to get walnuts. Zobo is also good. Now, these things that will improve your vaginal health, improve your female health self. Then pawpaw seeds is something else too. Pawpaw seed, you take the seeds of pawpaw, put like 4 seeds, you swallow it or don't chew it, swallow it. It will help your vaginal health. Yes, this is tamarind. Tamarind is on the picture now. Yes, you take this tamarind, see that inside. So when you break it, see that inside. That's it. You boil it. You understand? Boil it, put inside a rubber, sit inside. Your bum will enter inside. That's what a seeds bath. Seeds bath is not that you sit down on the bucket and only the heat. No, the herb, the medicinal, this will infuse into your body. You sit inside. You can wear your pants and sit inside, no problem. But sieve it there. This is a seeds bath. Thank you. See, so you sit inside. Don't go and cook your bum more, please. Ensure that the water is warm, tolerable. Then you put your whole pelvis, water will be inside. That's not the bucket that when you finish, you use it to mop bucket, mop ground. Go and buy it. We have even seeds bath bucket. And please don't share it with anybody. Finish washing it, pour hot water inside, cover it and keep it till next time again. You can do a coconut oil seeds bath. With what is that? You put coconut oil in your water. You sit on it. It's very relieving. Another thing you can do: apple cider seeds bath. A cup of apple cider, pour inside bucket. You sit inside of it. When you are doing all this your seeds bath, please wear pants. Try and wear pants. The reason for that is I don't want any particle to now from there enter. But if you are sure you have cleaned everything very well, then sit in. Then, in caring for your vagina, please avoid using panty liners. Yes, panty liners. Please don't use panty liners. And use cotton. Cotton is better. And do not sleep on this. Now, neem leaf. You can take neem leaf. Neem leaf is dongoyaro leaf. You can add it to your tea. 1 or 2 leaves. No more than 2 leaves, because it is cytotoxic. It's very toxic. Neem, that dongoyaro leaf, is very toxic. Very toxic. So just take 2 leaves only. 2 leaves. I didn't say 2 bunch. 2 leaves. 1, 2 leaves. Put side cup. Put drink. No more than 1 week and stop. Please, before you go and give yourself liver issues. Then mango. I already talked about mango. Eat plenty of mango fruit. Pineapple. Very lovely. Betel leaf. Please show us betel leaf. Betel leaf. You see? Add betel leaf. Make betel leaf. These things are very good for your body. Yes, this is betel leaf. Thank you very much. Then yogurt. Have yogurt every evening. Plain unsweetened yogurt. Not, have yogurt. You can add them with your berries. You can add other fruits to your yogurt, Then cucumbers. Now, this cucumber is different from the striped cucumber, but you can eat cucumber. Cucumbers are also good. Now, let's move quickly to breast disorders. Breast disorder. This is a disorder of the breast. And this is any type of pain or irritation in the breast or near it can cause a breast disease. It may be lumpy and painful or may just be painful and no lumps. It is mainly associated with either the menstrual cycle or pregnancy. Now, what causes breast disorders? Number 1 cause are cysts. Number 2 are trauma. Number 3 are injury. There is a difference between trauma and injury. Injury can be that you rub something that now causes sore. Trauma can be an impact, that doesn't cause a break in the skin. Fibrosis, infection, calcium deposits. Now, those of you that are always taking calcium up and down without doing tests, you can have buildup of calcium around your breast tissues that can cause you to have pains. If not treated properly, it will lead to breast cancer. So please pay keen attention. What are the symptoms of breast disorders? Now, it's not as if because you have breast, I didn't say this is cancer. This is not cancer yet. but this is a disorder. There can be lump, there may not be lump, but there's always pain, there's always discomfort, there's sensitivity, there's pain, the nipple becomes inverted, you know, there's lump under the armpit area, there's irritation around the breast, there's redness, there is discharge of blood or other things apart from milk, there's lots of elasticity, and then there is drooping. The skin of the breast is drooping like as if you want to fall off. You know, there's a separation between the skin, the skin and the inner skin and the outer skin. You see, so this is important. Now, for any form of breast disorder, there's one thing, there's one plant. There are different things though, but I'm telling you the things that if you do it within the time, 2-3 months, you will see changes. There's one plant that has the highest affinity, that is called marigold. Please show the image of marigold. It is, if you go to other people that are doing flower, it is a decorative flower. This thing I'm telling you so. Most of all these things, people like it for fashion. They put it around the fence. It's very beautiful. The medicinal effects, it is the beautification effect that people are looking at, not the medicinal effect. Please go and get it. Now, in caring for your breast, avoid rubbing breast enlargement cream, breast what cream. Please don't do that. In caring for your breast, to avoid or prevent breast disorders, get coconut or almond oil. First of all, wash your breast very well. When you are bathing, don't just wash your armpit and wash under your breast. Wash your nipple with soap, with water. Wash under, wash it, clean the skin very well around it. Wash it, it's very important. You know, don't rub breast enlargement anything. You see one thing on Google, please don't go and irritate the skin around your breast and give yourself breast disorders. Breast enlargement, breast firming. If you want to firm your breast, go and do exercise. There are different types of exercise. If you go to my page on Instagram, I posted quite a number of exercises you can do to firm your breast. Go and do firm. One of them is cobra pose. That one that you lie like a plank, like a cobra pose, like you, all the muscles of your breast, when you are done, you self, you will know that, the breast self will know that, something hits it with exercise. So do exercises. Don't rub anything. Now, massage your breast. Try as much as possible to massage your breast like twice every week or once every week at the minimum. Massage your breast. Massage upward like this. Like massage upward. Massage your breast with oil. Like you can use coconut oil, you can use almond oil. Massage in the evenings. Then try as much as possible, don't sleep with brassiere. Take off your bra. Wash your bra. Don't use one bra for a week or 2 weeks. Wash your bra so that sweat and all these things don't cause irritation around the breast. You understand? Then avoid rubbing any harsh chemical or any of all these things. And remember when I told you about xenoestrogens, be careful the things you rub around your breast and your breast so you don't go and expose yourself to breast cancer and breast disorders. Now, what are the foods to eat to improve your breast health? Broccoli. I want you to have broccoli, cabbage, you know, make them into stir fries. These things are very high in, they have ability to bind to cancer cells. So make them. You understand? Cucumber, cabbage, carrot, kale, broccoli, you know, saute them together. What saute means stir fry. Don't put plenty things, you know. And then as much as possible, stay away from supplements. There are lots of supplements that show the correlation between supplements and breast cancer. There are very many. Stay away from it. Now, flax seeds. Flax seeds, I've talked to you about flax seeds before. Remember that they have estrogen receptors, and so they can help you. So estrogen stimulated breast cancers will not form. Those breast cancers that come because of abnormal estrogen or xenoestrogens will not form because they have phytoestrogen. This phytoestrogen, they target those estrogens. So you see, these things I told you, that one is coming like this. That xenoestrogen is coming like this. This phytoestrogen, these ones are natural. Do you understand? They will go and cramp on those ones like this, bam, like this, and drag it with them as they are going out of the body. Remember that the body cannot pass it out. So the more you expose yourself to this natural thing, the more these natural things, all they do is they target estrogen receptors. So they will go and bind themselves to the abnormal one. When they bind themselves to the abnormal one, they will drag the abnormal one out of the body. That is the only way your body can excrete it. That's why you have to add it to your diet. You have to eat it well enough to see the impact. So don't say you eat it 2 days, say you did not see the result. Eat it till 3 months. 3 months you are eating it. You are dealing with cancer, your breast is biting you, you have cancer. Add these things to your diet. It may not be enough, but it is certainly going to help you by a lot of milestones, I tell you. Now, turmeric. Turmeric has curcumin. One of the things that turmeric you can do with turmeric is you add turmeric to your black seed, black pepper, take it together. You can add it to your soups. You know, when you are making your soups, add it to it. Turmeric is hardly affected by heat, so you can add it to your diet. Now, your potatoes, carrots, your colored potatoes, particularly your purple and your orange potatoes, please add them to your diet. They are very rich in vitamin A. This is good for the skin. This is also good for the tissues because carotenoids have been found to lower some type of breast cancer. Now, the next is we have your oily fish. Your oily fish, they contain cancer-fighting vitamin D and omega-3. Now, this omega-3, some laboratory science has shown that omega-3 can stop blood vessels from growing inside the tumor. So, they will go and frustrate the tumor. It will not have food. So, you can have things like salmon, tuna, sardines, mackerel, and avoid fishes that have exposure to mercury to get the most nutrients. For us to get into that, for you to know those, please go and watch the previous videos that I've done. These other videos are free. You can have them on the YouTube page there. It's there. Just check. You'll find it. Now, we have blueberries. You have your berries, your blueberry, your strawberry, your raspberry, any berry you can find. Get them. Whether they are frozen, provided they are not stored with sugar. You know, fresh, frozen, you know, add them to your cereals. In your cereals, avoid taking cereals that are high in sugar and have sugary content. Something else you want to add is your grapes, especially your purple grapes, your red grape. They have high level of resveratrol, and this is linked to prevention of breast cancer, liver cancer, stomach cancer. So get as much vine grapes, the purple grapes, as much as possible. Walnut, I told you before that you should take at least 10 walnuts. See, walnut has plant-based protein. And the protein in walnut is better than the one you get from your meat. So try eating a lot of protein. There's a study that has shown that eating walnuts will slow down breast tumor growth and may even lower the risk of breast cancer. So when you see walnut, you will call it asala. You don't have walnut that when you finish eating, if you drink water, it will even be peppery. It will be a bit sour. Then do you know that walnut helps in regulating blood pressure? If you take up to 10 to 20 walnuts, your blood pressure will thank you. Now, soy products. There are lots of things that soy contains, and one of them is isoflavones. This helps to prevent cancer. They are anti-cancerous. Next are your lentils. Lentils, yes. Lentils are rich in fiber. You can have the green, the black, the red lentils. They are very rich in fiber and they can help you, you know. So, the next is black beans. Of all the beans that we have available, black beans are the healthiest type of beans. So try as much as possible to eat them because they are a very strong source of amino acids. Now, lastly, you can get your whole grains. Now, your whole grains and your whole grains, they are very, very good for you in your care of your breasts. Now, with this, I've come to the end of my slide. I'm just going to run through briefly. We have run through PCOS, we have run through menopause, we have run through menstrual irregularities, we have run through hormonal imbalance, we have run through PID, we have run through fibroids, and I've talked to you in the course of this about xenoestrogens I've also talked to you if you're trying to conceive, you're having issues with fertility. I've talked to you about some things that you should do. So what are some of the tests that a woman should do? Important tests that you should do as a woman. You should do high vaginal swab test. High vaginal swab test is a test that is done, is a culture analysis that checks your amount of bacterial load in your body. Then another test that you can do as a woman is urinalysis. Urinalysis will analyze your urine. Will also check urine. We check for culture through in your urine. You can also do a scan, an abdominal pelvic scan, to check your abdomen, to check your pelvic organs. You can do a hormonal assay. Hormonal assay is a hormonal, also known as hormonal profile. They will run your hormones and check your hormonal profile. You can do a liver function test. You can check your enzymes. You can do a lipid panel test, check all your cholesterol, check your PCV to find out if you're anemic or not. Do your electrolytes, your urea, your creatinine to check. These are tests that are very important. As a woman, they help you. You can do a thyroid function test. You understand? All these tests are tests that can help you to lead a better life, help you to get better results from the outcome of your lifestyle. And in all that you're doing, I want you to know that you matter and you are very important. Your emotional health matters. You saw that your emotions can affect your menses. Your emotions can affect everything that relates. You can affect your hormones, can cause you to have hormonal imbalance, can also cause you to have menstrual irregularities. So please and please and please ensure that you check your hormones. Then your sleep. How well are you sleeping? Are you sleeping well? Are you sleeping for long? You need to sleep. You need sleep. Sleep is important. You need to be able to separate work time from sleep time. You need to be able to do all this. And lastly, I want you to know that you are enough. So stop trying to be somebody else. You are enough, and do the best that you can do. If you have any question, please drop it on the group, and I'm going to respond to you. And I believe that I've been able to answer as many questions, and I've been able to cover all of my slides now. So you can drop your questions, and I'm going to answer you on the group. I hope that you've learned quite a number of things today, and we'll continue this on the group chat. Have a good evening. God bless you. Bye. And no question yet now. They are still watching now, or they have logged off, I don't know. How many people? Oh yeah, call me back now. Let me drink water. Can you not go? Let me see your questions. So I think I'm going to take the questions on the group, as I'm not getting questions being dropped. Okay, I can see some people typing on the group. All right, thank you, Madam Nelly. Yes, thank you so much. I'm glad that you learned so much. Thank you so much. Thank you for your feedback. I appreciate. Now remember that the video is available for the next 1 month, so you can have access to it. And I'm in the group with you. You can drop your questions on the group and I'll answer as much as I can. The reason we're using YouTube is because this is a grossly discounted class, and if we were to use other platforms, we would not have been able to discount to this extent. It will not cover the cost of the logistics for the streaming. So yeah, you please drop your question on the group. Oh, thank you. This is enlightening. Thank you so much. Thank you so much. Yes. You know, because it is a private class, comments are not supported by YouTube, you know, but I'm glad that you've had a nice time. I'm glad it was worth your time. Please watch the video over and over again. Thank you so much. Thank you so much. Thank you. I'm glad that you found it worth the effort and worth the time. Thank you so much. And I look forward to seeing a better you, a better outcome in your health as a woman, and you using this information to prevent every of these concerns that I've talked about today. If you have just minor pains at the back of your left side, as if menses want to come and your age, yeah, so this, if you are 50 plus, that's menopause. Those are menopausal symptoms. All those pain as if menses want to come is menopausal symptoms. So try one of the remedies that I told you about. You are 50 plus, those are part of menopause. But like I said, go and have sex. Okay? So, madam, sex is something that would help you a lot in menopause. Yes, if you are in menopause, try as much as possible to have sex. Try as much as possible to have sex, yes. So this minor pain you have at your side, as if menses want to come, is part of the menopausal symptom. It may be that there's an infection, we can't tell, but you can go do this test that I've told you about. You can go do those tests to find out if there's infection. So please also let me not just disregard it and say it is just menopause. These are some of the signs of menopause, especially if it is about the period of the month where your menses would have normally come before, you know, you know. So yeah, so that may be it, but please, can you do a pelvic scan, to check, to be sure that there is no infection, especially PID. And you know PID, like I said, PID can stay for months, for years. You know, the person will not be manifesting the direct symptoms. You understand? So that's That's it. I hope I've answered your question, Madam Abidemi Fajobi. Please kindly do test. Thank you so much. I'm glad you had a wonderful time. Thank you so much. Thank you so much. Permission to sign off now. Signing off finally now. I've been talking for the past 2 hours. Thank you, and I'll see you next month. Bye.